We did have a very lengthy interview with Dr. Manabe the last time. So now we just wanted to have an additional, just to see where the department comes into play with regards to now the Phelophepha, the services that you guys are going to be assisting. What is it that you guys are going to be bringing on board with regards to now assisting maybe the trade?
No, thank you very much. I think we must first start by appreciating to have Phelophepha 2 in our province in the city called Kimberley. They are doing a splendid job, great job. Check, fundamentally, there's a service which has been provided by Transnet. Transnet is an SOE of our government. So they saw the gap in the niche, so they're working closely with the Department of Health. So what they're doing, they're augmenting the work we're doing. They're aware about our gaps in our systems. So when they come to train, it's just to really reinforce and to respond quicker in terms of the needs of our people. But as government, we're one government in the state. We're doing what they are doing is what we're also seeking to do, but it's also what we are doing. So when they leave with the different services they're giving, whether it's eye care clinic, whether it's dental care, whether it's psychology interventions, as they leave, because some of the work will be ongoing, we will then be still providing the same services as the department, even as the Department of Health. So there's not really any different work we're doing. We're doing the same thing. They're just trying, what they're trying to do is to help us where we're lacking, accelerate and also reinforce the work we're doing. So some of the services they're providing as they leave, some patients will be referred to our facilities in the ongoing training, but also some of them it's once off. I mean, to remove a tooth or a teeth, I mean, it's once off. Some people need some reading glasses and that, they will be having glasses, they will be very happy. Some will be having maybe like continued problems with their health. They'll be coming to our facilities, to our clinics, our hospitals. So that's why as a department, let me say, I'm very blessed, with the work the team from Transit is doing. So that's why we've been here. We've been here since they've been here as a department. But just to give them support and to say that we are with you, we're trying to improve healthcare services in the province, in the country. And this train is moving the whole country. Yes, so from here they'll be going to DR. Last year they were also here, they were in Zanzibar last year, they were in Zanzibani, they were also in Tatlas, doing the same job. From here they're going to Tatlas for 3 weeks. So in that class as well, we're expecting the same numbers of people to join Phelophepha for the services they are providing. So we were very happy for the work they're doing. You can see even for example the numbers here. It means that they're helping us to reduce the burden in some of facilities. But when they leave, we have to keep on providing the same services. So we're gelling, we must be gelling together very well.
So last question. Regards to now, Esther has been saying that you guys have been here since day one.
Yeah.
Now, some of the people have been complaining regarding the sanitation, water and all of these things, and the fact that they've been sleeping here since Sunday.
Yes.
So what is it maybe that the department could have done different maybe in terms of assisting with toilets, maybe mobile toilets and such?
No, unfortunately, it's about unfortunate to have those incidences. We call them incidences because they're not there like permanently. Of course, the program and the plan of this service is not for anyone to sleep over. That's why there's no provision made, whether for beds, blankets, and for any type of maybe to even refresh in the morning. But the nature of our people, when there's a high demand, especially the eye clinic, because there's a high demand. So everyone wants to be first in the queue, both young and old. They want to be first in the queue. So I think that day when I leave home, because I check what the ones who are complaining, they're all from Kimberley. They're not even from Warrington or even from outside town. They're from Kimberley. But yes, they want to, when you mean, you want to be helped first. So they think that, no, let me not go home, let me stay here. So in the process, then it creates that unfortunate, unforeseen problems of ablution facilities, washing. Very soon they will tell that we need food, we need to wash. But with ablution facilities, there is extra mobile clinic facilities which Transnet has provided. It's just that they were not maybe properly briefed. But I think the major gripe is the waiting.
Yeah.
Yes, but you can also see there's a high interest and high demand, in fact, of classes, because anyone from age of 30, 35, 40 is even getting worse. Our eyesight case is taking a serious down. So, in fact, we're talking about the team. It means that we have to ramp up our work in our facilities, in our local clinics, on our eye clinics, so that when the train leaves, Phelophepha leaves, then we can also provide the same services at the same rate, so that we reduce. There's a high demand, and which we appreciate, but also we're learning also to check where we need to improve, and we are confident that as the train leaves, the Phelophepha train leaves, we'll try and improve on that. Maybe a quick one. Maybe you want to be aware. Here in St. King Matthews in Party West, we had a collaboration with Christmasburg CC. So the minds there from Christmasburg, they were giving us doctors to perform cataract clinical work. So many people got help for the cataracts to be removed and all that. So unfortunately, the process, our theater table broke, and then that service was disrupted. Now it's been bought. We are ensuring that all our theaters must function, so that some of this backlog. There's a huge backlog. What you see is a backlog, because we're the same service at GDH Hospital. It got interrupted when our only optometrist left, who was from Hartswater. There were some issues, and then that unit was about closed. That's why even many of our old elderly people had to wait long for their class and all that. So what they want is like instant service. They check you, if you qualify, you get your classes. So I think there's one a good deduction we could quickly observe, which we need to improve and bring back in our facilities. But so far, so good. We must commend Phelophepha to Transnet. With the support of the health department, I think they're doing a splendid job. They are doing an excellent job. And you can see our people, they are coming on their own, spontaneous, on their own. No one's transporting them. They wait because it means the service is brilliant. And in some of our facilities, we don't have this type of service. I mean, I went there in one course where they're providing the dental therapy service. They're having five tables there, and they're busy, full. So it shows that there is progress, and that's what we need to sustain. You see, as government, sustainability.
But then MEC, what I don't understand, especially, okay, I understand with the eyes, but I don't, especially with the dental, what's different? Got to look at, because there's day hospital, which is absolutely free.
Yes.
And then here I understand you pay like 10 grams.
Yes.
So,
yes.
And I mean, you have to come all the way from communication to here. What is the difference?
The problem with some of our facilities, like even near GDH, for example, or take even some of our clinics, they also have the same services of dental.
Yes.
But at times, there's no professional there, like a dentist, there's no dentist there. Or at times, one of the machines there, it's broken, and they have to be referred to GDH to RMSH. So someone's having a tooth problem, wants to remove it quickly. So Phelophepha provides that particular service quickly. The tooth has been pulled out. I went there. Some scholars, the youngsters, you could hear them screaming there because they're the ones likely to have dental challenges or problems with their teeth. So it's much more quicker, and they have the necessary hands or skilled people. So in health, one of our key challenges is it's personnel. in other areas, we don't have the properly qualified people we need. So yeah, there are 5 tables working at a time. So it means that they can quickly help you. Yeah. But as soon as they leave, these other areas will have to ramp up our work. We'll have to improve as a department. But also, unfortunately, with the department, you can't determine how many people will be sick tomorrow. Yeah, that's one as a major problem. I always made the difference with education. Education, they give you a class with 40 learners, with 1 teacher with a teaching material. You guaranteed. You won't be having extra learners. They might reduce because of attrition. But in here, anything in hospital, today you have 40 people or 20 people, tomorrow there are 40. The third day there might be 80. With the same staff, by the way. Same doctors, if there's doctor, same nurses, there are nurses. So it's a cumbersome mandate. And because that's why we're the first to be always on the roll and to be taken out. But it's the nature of the service. It's quite cumbersome. It's huge, and it's unpredictable as well. You know. So, but I think all of us must be happy, especially for the people of Kimberley, to have people of Phelophepha right at our doorstep, and I'm happy with the number of people who are coming around. Yeah, I met some mamas that's equally there. We're very happy, by the way. He said, "Missy, clearly we get our classes now. Oh, when we are taking some time there by you." And I said, "No, we're on the same team." Yeah, and I like it when the equipment they have. Maybe we'll have to look into that. To have them in our working facilities. GDH, maybe for example, a little better clinic, GDH, and reduce the workload at that message. Yeah. But we're very happy as a department, as a province, and what's expected from us is to encourage people to come here, those who can come. But also, you must also help us, the media. You must discourage people to sleep. Yeah. This operation is not meant for anyone to sleep. That's why when the place where they're sleeping, it was never prepared for them to sleep.
That's why there are no lights there.
There's nothing there because we didn't anticipate anyone to sleep. Yeah, but because also we are very, very kind to our people. So we allow them to sleep there. But in terms of the plane, there's no planning for anyone to sleep. That's why we didn't want to be populist. We'll get to blankets, we'll get to what and what to encourage to sleep. We must encourage them to not to sleep there. Tomorrow morning, you must come early and join the queue. Because luckily also. No, they shouldn't do that. At least they can come early 5 o'clock. It's time to work after 7. But when they're ready before 7 or 7 o'clock, they can help them. But we must discourage our elderly people to sleep. Number one, it's not even conducive, it's not even safe. But also, it's not meant for anyone to sleep there. Yeah.
But also, just in passing, I think there's also like economics involved. Because there are
vendors, people selling, people always are people are vigilant. When there's a need, because the many people come here, people come and sell, and we're not stopping them. But we must thank the train, and they're doing a good job. And I checked with Dr. Panabella, when are you coming back? He said, no, there's a time schedule. We're not coming back anytime soon again. I must see you after 2 or even 3 years.
That's what I was just going to ask you. How often do you guys come here?
I think there's a high chance not come. If you do come, we encourage you because we're also looking at servicing other towns to Kimberley.
Oh, so meaning they too might come to the Northern Cape, but not necessarily.
Which is not in Kimberley, outside Kimberley, but it's not.
Yeah, that is within the province. But in terms of your demographics, I'm sure you agree with all the provinces. How are the kind of illnesses or the type of people that
they differ from station to station.
Yes.
And from season to season.
Oh, the
now,
season also plays a role.
Yeah, and then also demographics. In areas where there is rivers or during the the waitress is we find those challenges relating to the if we have a area next to a mini area this profile will change as we move to station. You cannot say no, there's a lot of people that are coming through with food. They differ from station to station. When they come from station to station, what they do is the performance is personal enough. Within the first week when they get there, they can see the profile and then they ensure that they can stop